Hi guys, my name is Richard Smith. I'm the Respiratory Therapy Director for Cherokee Nation W. Hastings Hospital here at Tuckwell. Kind of show you little things about how our handheld nebulizers and also a little bit about our meter dose inhaler. This is for training purposes only. Kind of show you kind of variations what we have here. As you can tell, we have right now we have two different type of nebulizers. We have one that's called the band neb or breath actuated nebulizer, and what that is, I'm not going to open up here. What that actually kind of does, as the patient inhales and breathes out, this little knob on top will suck down, so it only nebulize as the patient breathes. And you can actually turn it here onto a knob on top as well to making it to a continuous, where in a sense that's what this other one is. But the band nebulizer is actually, it's a better nebulizer than the other one because of the particle size. The particle size is a little bit smaller, so they can kind of get down in the alveoli or into the lungs a little bit better than the other one. But this one we mainly use up on the floor. We really don't use it in the emergency room or in the outlying clinics or in OR or anything. We use just the regular nebulizer for that. And we'll talk about this here for our demonstration today. You have a flex tubing, you have what they call the acorn itself, which is the nebulizer, T-piece, and the mouthpiece. We'll go ahead and put the mouthpiece here in that T, and also the tubing that will go along with this as well. So the tubing itself, as you can kind of tell, will actually hook up to the bottom of the acorn and bottom of the nebulizer, and the other one will go into the bottom of the flow meter. Now, this flow meter here, we're kind of running on auction just for demonstration purpose only, but try to do the best you can to actually run it off from an air flow meter, which is yellow. And these what's called Christmas tree adapters are plastic. Always throw away at the end of every, or if you're doing an outpatient one-time treatment only, throw it away at the end of that because they are one patient, single patient use only at this time. So what we're going to do this is I'm going to use saline for nebulizer purposes today, but always verify your order with whatever the provider wants, either albuterol or it might be a Duaneb or whatever, but always verify the order before you do that. Also verify your two patient identifiers, your armband, and ask the patient their date of birth and also their name. Scan the medication so for being an administration part of it all, so being at the MARs. So here we're going to do it this way. We'll put the saline here just to kind of show you what it is. We'll put the T-piece on and also the flex tubing. So to set this, you'll run it about 8 to 10 liters. So we'll go ahead and turn it on. So we'll put it on about 8, and you can kind of see a nice nebulizer, a nice mist coming in that. So you have the patient breathing in and out through that, put their mouth around their teeth around the tube, take some slow deep breaths in and out. Sometimes I encourage try to hold a breath about 2 to 3 seconds in inhalation, so to kind of help nebulize a little bit better, maybe kind of dilate a little bit better. Also, check your breath sounds before and after your breathing treatment. Check your heart rate before and after your breathing treatment, and maybe sometimes during, because some patients will have possible reaction to the medication that that you may put in there, such as albuterol. Albuterol has a tendency to kind of increase the heart rate up a little bit. Also, try to explain to the patient before all this what you're really doing. So keep running this, and usually lasts around about 6 minutes, kind of give or take. But all till the medication is gone. You can kind of see right there, kind of see a little droplets kind of going on. So make sure all the medication is gone before you stop the handheld nebulizer. And once it's done, just turn it all the way off. If it's a single patient use only, go ahead and pull it off from the flow meter, as well as the Christmas tree, and throw it away in the trash can. And again, if it's only if it's a single patient. If it's a multiple patient, or if we do it again on a patient for like Q4, Q6 treatments, there should be like maybe a patient belonging bag or something we can actually put this back in, and that way we can use it for next time. So let's talk about the little meter dose inhalers right now. Okay, meter dose inhalers basically is either albuterol or Delera, any kind of inhaler that is propelled by a gas mixture in a sense, okay? So we have your meter dose inhalers, and also you have your dry powder inhaler, which is like Spiriva or tiotropium. Now Spiriva tiotropium has a little pill, a little capsule that you'll actually open up and drop down in there to actuate it. And when you do that, when you talk to the patient to instruct them, make sure they do not breathe through that little discus. If they do, all the medication that you just put out into that discus will go away. So so the demonstration for a dry powder inhaler and the meter dose inhaler will be the same way, except for that little side note they have on do not breathe or blow out through that discus part. So we're kind of using today is an albuterol, and also we're using what's called an air chamber. So I love these air chambers, and try to use these as much as possible wherever you're at. Although the patient may understand well, they may have a good coordination with a meter dose inhaler, because you have to have a good patient coordination with meter dose and or the dry powder. But the air chamber will actually, I believe, just you'll be able to get more of the medication into the patient better this way. And that goes into the back of here. We'll take this out here real quick. This is a brand new albuterol. We'll act like we're got a brand new albuterol anyways. We'll always shake it up. For primer wise, we'll kind of do about 2-3. That way you know the mist is there and it's ready to go. Put the albuterol in the very end of the air chamber, or the spacer, a lot of people call it, and the patient's mouth will go around towards the end. Now, to instruct the patient on this, the patient's mouth will go around the end cap here. This will go off, and I'll blow through it. You'll instruct the patient to blow or exhale out all the way through this until they empty out. And when you tell the patient to breathe, or have them do that, then as they breathe in, you will squeeze the albuterol MDI, and as they breathe in, the medication will be propelled through the spacer and it'll go into the patient. What I love about the spacer is if they breathe in too fast, it will harmonic at you. In other words, it will kind of whistle at you or whatever. Kind of give you a demonstration of what I'm talking about. I don't know if you heard that little sound right there or not, but that's the faster they breathe in, the louder that a harmonic sound is. And that, in a sense, that is a no-no. Because we do have a tendency, or we think we should be able to breathe in deeper if we breathe in faster, but in all reality, we don't. We could take a deeper breath in slower than we do faster. So always have the patient exhale all the way through this and take a slow, deep breath in, and that way it won't harmonic. Just like that right there. And as they breathe in, started their inhalation, squeeze the MDI. And the purpose of the spacer too as well is that they get more medication this way. Because when we do it just directly into the mouth, some of the medication will actually stay in the mouth. So we want as much of that medication into the patient as much as possible. And again, this is for MDI on a dry powder, which would be a discus form. Have the patient turn their head, breathe all the way out, then put their mouth on that mouth port, then breathe in slow and deep. You cannot use a spacer on a dry powder inhaler, but you can use this on any kind of meter dose inhaler that will actually propel that medication, propel it through this. If you do have any questions at all, feel free to contact me, richard-smith2@cherokee.org, or call my office, 918-458-3504. I'll explain to you or give you kind of any answers that I can. If you do, thank you so much for reviewing this, and talk to you later. Thank you.